Everyone, I see you coming in from the lobby. I'm going to give it another minute and we'll get started with our dashboard presentation. I know there's a better title for it, but we'll just call it dashboard for right now. All right, it is 2 o'clock or 1 o'clock Central Time, 2 o'clock East Time. I'm going to go ahead and get us started today. Welcome to the Rural Health Educational Series. I am Cody Smith, and I'm the Director of Rural Partnerships with NRHA Service Corporation. And I know a lot of you know me, but I will be our moderator and walk us through everything. So this session is being recorded. We'll email that recording to everyone who registered later today, so no need to scramble for notes. You'll have it to rewatch or share with anyone who you think would find the information useful. At the end of the session, there is a brief survey. I know we don't like to fill out surveys, but if you could just take one moment and fill that out for me, I really do go through all of those answers and I use your input to make sure these sessions are relevant and useful for you and your peers. So quickly, let's cover a few housekeeping items. All attendees are muted to ensure the session runs smoothly. The presentation should last 30 to 45 minutes, and this will give us some time at the end for a Q&A session. But if you have a question, don't wait. Go ahead and put it into that question section of the control panel as it comes to mind. I'll be sure that we get those questions asked and you get your answers. This is your chance to ask our expert and get advice tailored to your challenges. Today, we are excited to have an exceptional speaker, Keith Bublow, helps rural hospitals use their own data to make smarter strategic decisions. He specializes in market analysis, patient distribution, and drive time modeling to identify areas of risk and opportunity, giving rural executives clearer insight into service line performance, community access patterns, and long-term sustainability. So with that, I'm going to go ahead and turn it over to Keith and get us started today. Thank you, Keith.
Great. Thank you very much, Cody. Thanks for the introduction, and good afternoon, everybody. What I want to do is talk about the State and Congressional District Profiles Dashboard. This is version 3 that we've been working on in partnership with NRHA and NOSORH. I want to tell you a little bit about the dashboard, what it is, kind of why we put it together. I want to show you some examples of how people are using it and how you might be able to use it. I want to talk about what's new in this new version since the last time that we released this. And then I'm going to go through the sources. And then I have a couple of slides that just kind of show the layout and the function of the dashboard and the different tabs. And then I want to go into a kind of a quick online demo of where the dashboard lives, so I can show you kind of how that works. And then at the end, we'll have some questions. So as I said, this is was a joint kind of collaboration between Stroudwater and NRHA and NOSORH. We started back in 2023, the fall of 2023. And the goal for the dashboard was that NRHA was looking for a comprehensive resource, a free resource of rural health data. So what we wanted to do is put together, rural specific facts about states and by congressional district for use, for education and advocacy specifically at the congressional level. We wanted to use data that was recognizable and also publicly available. So everything that you see in here exists other places. It's publicly available data. It's recognizable stuff that you've seen before. We also wanted to provide critical and timely information on what were initially the 3 pillars that NRHA was focused on, which they still are, of infrastructure, utilization, and health equity. And since then, we've expanded upon that to include things like outcomes and other health factors and additional pieces that are prevalent in and critical to America's rural communities. And the big thing I think for this was to put all of this data in one place, because as I said, these publicly available data sets are available out there. But as I know as an analyst and doing research, it's kind of hard sometimes to get everything that you need quickly without spending a lot of time. So that was the really big goal here, was to have everything kind of at your fingertips. So as I said, this was first released in February of 2024 at the Policy Institute in Washington. It's been updated and re-released kind of semi-annually based on our user feedback and then what NRHA or NOSORH kind of had asked for. So how are people using this dashboard? This is, you know, in the years that we've had this out here, we've heard from people who are grant writers and policymakers, researchers, analysts, and then hospital executives as well. And some of the examples are, you know, community presentations. It's great for education. Somebody looking at helping the Rotary Club. Grant writing was a big thing that we've got back. Again, policy messaging. I just recently rolled this new version out at the Policy Institute in Washington, so people can take it up to their congresspeople and say, here's what's going on in your district in terms of rural. State Office of Rural Health is using it. Just understanding your you know, the rural areas of your state legislature meetings. We had an example of Delaware who asked us to give them a version of this so that they can embed it on their own website that had other data biz tools. And then more recently, and this happened just last week, people using this for Rural Transformation Fund grants. A rural health clinic in Arizona reached out to us and said that they were going to use this, and they were very happy to have the data available. This little thing in the bottom left-hand corner is actually when I show you where the dashboard lives on our website. This is a kind of a feedback and question form that is available. This goes directly to me, so if you have any questions or suggestions that you have through this, you can send them to me directly, and that's kind of where we get all of our insights. Because a lot of this has been collaborative with users such as yourselves, just kind of saying, you know, what else could we add to this that might make it helpful. So I want to talk about what's new in this version. We've updated the congressional district boundaries to kind of account for some of the different redistricting things that we're working through courts, you know, like in Georgia and things like that. So those are all accurate. We've refreshed the data and we've updated the data sources. We've added some new measures. The ones in that list below there. We've added Medicaid populations. This comes from Kaiser. We've added closed and converted rural hospitals from the Shep Center. I've added some secondary source information. Some researchers were asking whether, you know, what the actual data of the data is, not just where we got it. We made the data downloadable. The whole dashboard is downloadable. And then recently, NARC, the National Association of Rural Health Clinics, reached out and said that they were using it and asked if they can be a sponsor. So we added them as well. Before we get too far in, I have one poll question. So I'm not, just to find out how familiar people are with this dashboard. So I think this is our first poll question here. And Cody, I'm going to have to go out of, I can't see the poll question, so.
It's okay, I can read it to you, T, so you don't have to change your screen.
Okay.
So the question is, how familiar are you with the state and congressional district dashboard? The options are used before for grants, presentations, education, and/or advocacy, viewed it but haven't used it for anything, heard about it but haven't viewed or used it, or this is my first time hearing about it. Looks like we've got about a 75% response. I'll go ahead and end that and share those results with you, Keith.
Okay.
All right, so it looks like 14% of respondents said used before for grants, presentations, education, and/or advocacy. 11% viewed it but haven't used it for anything. 19% heard about it but haven't viewed or used it. And then a 57% that this is my first time hearing about it.
Perfect, because that's kind of what we're going to talk about. So as people haven't heard about it yet. So, all right, thank you very much. And you guys can still see my screen, right? That's okay.
Yeah, I can see your screen. I'm sorry to interrupt. I did have one person say they can't see, they're seeing a green screen, but I do see them. If anybody else doesn't see it, let me know. I think you're good to go. Okay,
all right. Okay, so the sources that were utilized here, as I said, they're all publicly available. So we relied heavily on NRHA, the hospital cost reports, Stroudwater downloads cost reports, and we've got going back almost 20 years now of that data. So we were able to mine that for some of the utilization information that's in there. Like I said, Kaiser Family Foundation, some of the federal websites, you know, BLS, Census Bureau, CDC, the MPI file is for the physicians, the Shep Center, which is great, and then University of Wisconsin, which is the county health rankings. So first question we had going into this was how to define rural. There's a lot of different ways to define rural, and for this case, we just relied on HRSA. So for infrastructure and utilization, all of the facilities that are in this are just based on HRSA's physical address of the facility and what they define rural. For workforce, it's a zip code level of the provider, identifying which, and we're using a HRSA crosswalk to identify which zip codes are rural. And then for the rest of the county level data that's in here, that's using HRSA's rural county methodology. And then we took all that stuff and just assigned it to a congressional district using shapefiles that we got from the Department of Transportation. On every tab, there's either a little indicator, a little filter or color key that tells whether it's rural or not. And you can also highlight many of them just to see which ones are rural so they stand out. So all right, let's get into the tabs here. This is kind of what the first tabs look like. Just as to start here, up at the top, you'll be able to select all the different tabs that are in the dashboard. You can see what they're called there. This one is infrastructure. It's the opening one, and this includes the list of the facilities that you see on the side there. So you've got your ASCs, we've got the different types of hospitals shown, FQHCs, home health, rural clinics, and SNFs. And then if it's just a count of all facilities that are listed. And then kind of the way that the dashboard works is on the upper left-hand corner, you've got your state congressional districts. Which you can, and I'll show you when we get into the live demo how that just works as a filter. Basically, just changes all the charts and graphs and maps to just the congressional district that you pick. On the bottom left, it shows the source of whatever it is, the measure that you're looking at, or the page that you're looking at. And then as you mouse over some of the images, the maps, you'll get some more information about the underlying data points that are in there. And then just up in the upper right-hand corner is the selector that you use to select your state. The next tab is utilization. It's very similar to the previous one, and this just takes kind of a subset of those facilities that we looked at and looks at kind of what their volumes are. So showing rural versus non-rural volumes for in this case we're looking at beds for the hospitals and discharges, and then one of the approaches we wanted to look at was kind of births. There's not really a good publicly available data set for total births, so in this case we use as a proxy labor and delivery and nursery days, and we also show swing bed days in there as well. And then we have visits for the clinics, and in the case of RHCs, both freestanding and provider-based, and then looking at days for the skilled nursing facilities. So what this is showing is what is that percentage of all of those different metrics, those utilization metrics in rural areas within this state. Then you can see on the map on the lower left-hand corner shows which of those facilities are actually in a rural area. So this has been helpful to look at kind of, what is that impact? How important is rural in your state, or when we get into it in congressional districts? And really just kind of shows the impact of what's going on in these facilities and how important it is to the local areas. The next tab is workforce, and this is looking at individual providers in the community, doctors, nurses, PAs, dentists, therapists, things like that. We've got the classifications of the medical specialties of all the different provider types in the lower left-hand corner. We've rolled them up into just kind of more generic classifications just to make it a little bit easier. So. And on the right, we've got the list there. So we're looking at primary care, behavioral health, and oral health as being very, very important for rural are important there. Oral health is going to include things like dentists and also dental hygienists and things like that. And then we've got the other nursing, nurse practitioners, pediatrics, and then some of the medical and internal specialties there. But again, showing kind of what is that the percentage of those providers that are within a rural area versus a non-rural location. And then on the bottom chart there just kind of shows the total count again. So this is just individuals. It's not kind of FTEs, and it's based on where the primary location, office location is for each of these providers. And again, this is using the MPI file that's a download from CMS. Our next tab is shortage areas. This is straight from HRSA's Data Explorer, showing all the HPSAs that are within the state. Again, this is looking at the county level, and with a filterable by the congressional district. And we've added some other additional filters there. So you can look at by shortage area type, you can look at designation type, filter whether it's rural or non-rural, these are designated and proposed for withdrawal. You can also filter by that. The mouse over will give you actually a drop down of what those individual HPSAs are within that county, and their HPSA score in parentheses. And the next couple tabs are very similar. These are at county level, and these are kind of pulling from heavily from the CDC, from Robert Wood Johnson, county health rankings, and some other county level comparisons. And this shows prevention. So what we've done here is we've taken kind of the analysis for these different metrics, these different measures. So annual checkups, screenings, different types of screenings, dental visits, insurance coverage, medications, and mammographies, and then compared the county percentage to the state benchmark, and then also there's an indicator for a national benchmark there as well. So in this case, we're looking at Georgia. So each of the counties will show, blue is going to be higher than the state benchmark, and there's more orange, as it gets kind of darker orange, is going to be lower than that state benchmark. It'll be kind of either higher or lower or positive or negative depending on what the measure is. On the lower left-hand corner, we've got the county name, and it says whether it's rural or not, and then what that data value is, and then what that variance is from that state benchmark. And I'll show you as we get in. You can see there's the measure that you're looking at, and what the benchmark is. Again, as you mouse over, you'll be able to get some more information about what's going on here, including the populations of the county and some of the more detailed source data. There's a drop down here for the different measures that you can select, which I'll show you when we get to into the live demo. The next tab is very similar. This is looking at health outcomes. So these are medical conditions that affect kind of the quality of a person's life. Again, same kind of basic approach here is looking at the state benchmark and whether those counties are higher or lower than that individual benchmark. We'll point out that each of these different measures will have different populations that are looking at. So, and it'll show you up in the title there. So in this case, this is looking at tooth loss for people who are over 65. So the state benchmark is going to be calculated towards that same population group, and we use the CDC data to do that. I'm sorry, the census data to do that. So in this case, we're looking at tooth loss, a bunch of chronic diseases, depression, high blood pressure rates, mortality rates, including some of the child mortality was one that we added, drug overdoses, life expectancy overall, which is an interesting view, some opioid stuff, and then suicides. And then again, the state and national benchmarks there. The next tab is health factors, and this includes things that are, kind of those health equity measures, plus other things that are relevant, that are can affect a person's health. So we're looking at populations, things like broadband access, children in single-parent households, kind of food insecurity, housing insecurity, food stamps, transportation barriers, and then the disabilities, poverty, things like that. So what are these kinds of health factors that can affect those populations? This is just a little side here. Unfortunately, these are not available for every state. Most of the states are in there. So, but if you're using the dashboard and you get a blank page, it's because there is no data for some of those different ones. We will work to fill those in if we can as the data becomes available. And then the last three tabs are looking at kind of Medicaid, Medicare coverage, specifically Medicare Advantage, and the percentage of the enrollees. This is using the CMS releases an update every month or so, showing the number of eligibles within the county and then how many of those are enrolled in an MA plan. Recently, when the HR1 was being debated, Kaiser came out with some data showing just the percentage of population enrolled in Medicaid by congressional district. So we grabbed that and added them in here, kind of changed a little bit, but I have a link to their source data in there. And then most recently, we've added the closed hospitals. So this is just a real basic look at what the Shep Center has. They track closed rural hospitals, either closed or converted, or either they're converted to outpatient or REH. And this just shows a count of those by the different congressional districts. So how to use the images and the data. As we talked about, people using these for grant applications on the dashboard itself. If you're familiar with Tableau, if you've ever used that or online, it's kind of pretty easy. In the bottom, there's a little thing there to download. You can download it as an image file. You can download the crosstab, which will give you the data behind it. You can download the whole thing as a PDF or a PowerPoint, or you can take the entire Tableau workbook if you know how to use that, and you can manipulate it from there. So I guess, again, we've made this very easily accessible to grab this information if you need it to drop into your presentations or your board reports or your advocacy efforts. All right, so now I'm going to switch over. If you give me a second here, I'm going to go over to kind of the live demo. Okay. Can everyone see my my browser screen?
Yes, I can see. It says Rural Health Insights for each state at the top.
Okay, great. And before I do that, I'm just going to drop into the chat. You guys can. Am I able to drop things into the chat? Yeah. I put the link to the dashboard in the chat if you wanted to follow along. But this exists on our webpage and our Shroudwater website. So the top here, just going to give you just all the information that I just talked about while we did this, what the data sources are. The dashboard itself is right here in the middle of the page. And I'll show you how that works in a minute. But before I do that, I just want to go down to the bottom here. This is that feedback and questions tab that you can enter. Again, please feel free to use this if you have any questions. Like I said, this goes directly to me. Suggestions, we're always looking for suggestions. A lot of the things that we've added throughout the history of this dashboard have been because of just user feedback. That is very helpful because it helps us to kind of put out information that is relevant specifically to to people that are using it. So I'm going to go over. It's a little bit easier to look at this in Tableau Public because I can go to full screen, and that'll allow us to look at. Okay, so hopefully everybody's seeing our full screen there. All right, so here's the dashboard. As I said, you can select your state here from the drop down. I'm going to go to Georgia again. Everything will reload. As I said, each of these is a highlighter. If you're familiar with Tableau, again, it's very interactive, so things can be highlighted, and you can actually highlight these things and then use those highlighted images and download them depending on what you want to do. But again, this will show you kind of the breakout from rural versus non-rural as you mouse over these different facility locations. It'll give you some more information about what is underneath there. And then looking at, as I said, each of these is a filter. So you can filter down to your individual congressional district. In this case, this is Georgia number 12, which tells you who the representative is in there, and then everything updates to show just the things that are within that congressional district. Let's switch over to utilization now. Again, kind of the same basic thing. This is a subset of those. We don't have all the information for all of the facility types, so this is a subset looking at hospitals and clinics. But again, clicking on your congressional district will break everything out. You get that mouse over here so you can see kind of what you're looking at here. And again, just showing what are the percentages of those beds and discharges and all this stuff, the utilization statistics that are fully rural. It's very interesting to look at different districts, different parts of the state, and just see how those numbers change. I think it's kind of fascinating. All right, just going to head over to workforce here. Same basic principle. Let's look at congressional district number 8. And again, everything updates showing what is rural and what is non-rural. There are a couple of ways that you can highlight. Like I said, if you hold down your control key, you can select, I'm using control and then just selecting these different ones. That'll give you kind of a highlight if you wanted to grab this image and then put that into a presentation, or kind of an education packet. Try to make it as interactive as possible. So it's easy to use. All right, let's move over to shortage areas. Again, this will give you a little bit more. We'll give you a little bit more information about the different types. So we did include kind of a drop down here if it's for some of the states, especially if you get into the bigger ones like California, which have a lot of congressional districts. It's kind of hard to see in the map. So this filter, this drop down will actually just work as the same way as the map if it's a little bit easier. We've got the different shortage area types here that you can filter if you want to show those. The designation type for the different types that are within the HPSA file. You can filter by rural status. Take these off and say, let's just look at completely rural for these, and everything is going to change. So now we're only looking at the rural counties according to NRHA. Let's filter on number 12 here. And then, as I said, if you mouse over, you'll actually get the HPSA names underneath and then what that score is for each of those. So there's more detail available. The RHC that we talked about in Arizona used this heavily and just did screen captures of this to show where the shortage areas were within their district, and it was very helpful. All right, next couple tabs: the prevention outcomes and health factors. Again, very similar. These are the different the drop downs here for the different measures. So I'm going to pick on mammography. So this is showing mammography use between women, among women between those 50 and 74 years. The state benchmark is 75.4% of the population, The national benchmark is 76. And then you can see in which areas are higher or lower in the state. There's a little highlighter here that allows you to select just the rural counties within the state. We can turn that off. And again, I'm going to grab this congressional district and kind of that'll show the difference. And as you mouse over, it will give you some more information, including the total population, not the measure population, but just the total population of the county, what that measure is. And then when I talked about, there's a little bit of additional source data in here. In this case, the source is from the CDC Places data from the 2025 release. But the actual data that they use to calculate that is from the BRFSS from 2022. So, and as you mouse over, you'll get that information there. So, Health outcomes, very similar. Your drop down here, you've got all of these different health outcomes that are relevant here. I'm going to click on life expectancy. And as you can see, the source data on the bottom changes. Now we're going from the CDC places to county health rankings and roadmaps. And again, showing that the state, you know, the life expectancy in the state, whether it's higher or lower than that, the state benchmark, and picking on the 8th congressional district here, you can kind of see how that everything changes. So in some cases, you might find that some of the measures are not available for every county. It kind of depends on what the measure is. I know that some of the mortality rates are generally not available for small, you know, so for smaller population counties, they're not going to show up. They're just you know, not enough data there. So that is it's a good thing in this case. So just note that. Let's switch over to health factors here. Again, same thing. Your drop down here, so you've got all these different measures that you can pick. You've got broadband access. As I said, some of these might not be available for some of the states. Most of them they are. All right, let's move on to Medicare Advantage. Again, this is looking at those eligibles, you know, the number enrolled, higher or lower than the benchmark. Let's click on another congressional district here. See how that changes. And then again, more information as you mouse over each of the counties there. Time here. Medicaid coverage. This is pretty simple. This is not looking at the county. This is just looking at the congressional district by itself. So showing that total coverage, and then we just added a kind of a percent enrolled here on the left, just as a quick reference. The source for this data is here. Kaiser have included the link, so you can go directly to the source if there's sometimes they have more information if you really need it to get there. This just shows the number of adults and you know, the eligibles that are within there and the total enrollees. And then finally, this is the new tab that we've added from the Shep Center, which does you know, great research tracking closed rural hospitals. Again, you're gonna have a limited source here because you know there's not gonna be closed hospitals in every district. But as you click on the district, we're looking at kind of you know whether the closure type. So these are all rural hospitals. Either they've closed completely, they've converted to an REH, or they've converted to kind of a non-inpatient healthcare facility. And then it just we're looking at it from 2010 through 2025, so you get total closures. Again, the data source for that is the Shep Center. There's a lot more information. They have a downloadable file, which is where I got this. So you can check those out if you wanted to get more information for that. So let me just switch over here. I think that's it. Cody, do we have any questions? You want to open it for questions?
We do have questions. So let's dive into those. And listen, if you have a question, go ahead and put it into the control panel of the question, or the go-to control panel for questions. We'll be sure to get to them. I've got a couple that have come in. I've had requests for slides. Don't worry, I'll get those requests over, but don't forget there is a recording that will also be coming out. First question, thanks for all the data. Can you explain why Medicare data are not included in only Medicare Advantage?
It wasn't a request. That's it could be. You know, it's an interesting thing. We could do that. It wasn't a request from NRHA. The Medicare Advantage was added specifically as a request from NRHA. So, but I think we could add Medicare. Like I said, a lot of the stuff is we add it just because it became relevant. So I know that you know MA penetration was something that was very relevant. Still is. And then that Medicaid data became relevant too with the passage of HR 1. So, but I think we could add Medicare as definitely. I think that would be helpful.
And there was a comment back to that. The Medicare data would be so helpful in addition to the MA data.
Okay.
Another question, is this information available for Alabama?
Oh yeah.
Okay. And they can just access that through the drop down then?
Yep. Let me just get over there and I'll just look real quick.
Yeah, of course. We've got time. We have time for questions, so don't hesitate to ask them. I know Keith is here to help.
Yep. Yep. Alabama's here. Actually, I usually use Alabama as the start just because they show up first. So when you load the dashboard. So yep.
Okay. Was data from county health ranking and roadmaps used for this dashboard?
Yes.
Okay, wonderful. Another question. We've got plenty of time, so don't hesitate to put them in there. Another question, how often is the dashboard updated?
We generally tend to do it at least once every 6 months. A lot of the information is going to be kind of a yearly update. And then some of it is, yeah. So usually around June or July, we'll do an update. We'll change, using the new cost report data that comes in. Some of the health outcomes and health factors don't get released until kind of the end of the year. So a lot of the CDC stuff that is in here now was released in December. So we were able to kind of take it, turn around, and recalculate it, and then add it for this February release. So yeah, I would say some of the things are maybe in the middle of the year. They're twice a year, and then some are yearly.
Thank you. Another question. My apologies if I missed this, but which definitions of rural are being used per state? So
yes, this is going to be based on on NRHA. So we're using NRHA for everything. Let's just go back to this. The facilities data is that NRHA has a download right from their website. You can just grab all the different types of facilities, and then that has a little indicator whether it's rural or not. And then they have a zip code crosswalk that we have from their website that just identifies which zip codes are rural and which ones are not. And then the same thing for counties. So they kind of calculate. Their calculation changed from the beginning when we started doing this. So we've just been using theirs, whatever they have calculated. I know with the counties, I think they use like the number of census tracts that are rural, and then assign a fully rural county or a non-rural county. So
all right, thank you. Another question, is there a way to access old dashboards to be able to compare past to present?
I could, if you wanted to send me a message, I can do that. I have the old dashboards. We just generally swap them out as we update them. But I do have the old data available to do comparisons. I would say reach out to me directly, and I can help you with that if there's a specific thing that you're looking at. The one thing I will say is I'm not, with because the CDC is estimates, I'd have to see how they do that. If you're familiar with kind of population estimates and stuff like that, sometimes I don't know if you can compare them year to year, but that's possible. But yeah, I'd be happy to help with that if you have some specific requests.
Thank you. Another question, how did you get the state benchmarks for the CDC places data?
Yes, that one we actually had to calculate. So in the download from the CDC, they have the national benchmarks available, and they've got it by county and also by zip code, which we use in other kind of more some of our market assessments. But they didn't have a state level benchmark, and that was important for us to use that. So what we did is we actually kind of went through their methodology and used the same data that they used to calculate the number. So what they do is they look at the population and then estimate the incidence rate or the percentage of population that has one of those, is affected by those measures. So we just kind of downloaded that same data from the Census Bureau. So in the case of mammographies, it was downloading by county just the number of women between 50 and 74, taking each of the county level percentages, applying them to the population within the counties, and then coming up with a total for the state. and then using that as the benchmark.
Great. Another question, it'd be great to see population changes to show the area is declining. Can that be added?
Yeah, I think that would be, yeah, that could be added. I mean, it would be just using census data. Could be an addition.
Thank you. Another question, do you have any data for pharmacies?
You know what, we don't, and this is something that has come up a lot. I do not know, and maybe the people out there would know. We don't know of a good publicly available data source for pharmacies. And so if anybody knows about one that might be available, that would be very helpful to know, because I know that's an important part, especially in the rural kind of rural delivery space. So we're working on it. I think it's something that we might want to add. Like I said, what we're trying to do here is to have every have it as comprehensive, nationwide as possible. So there are certain data sets that we have to use that are nationwide and are publicly available, not proprietary. So but if anybody knows of a good source for pharmacy information, that would be very helpful.
All right, thank you. A couple more questions. Does the data define the catchment area for individual facilities?
Like a service area? No, it doesn't. No.
Okay.
No, but we do. Oh, I'm sorry. So I know at Stroudwater, when we do kind of a market assessment, we can define that area using, we have Medicare market share data. And there's different ways you can do that, either by kind of a patient origin, a 75%, or you can, in some cases, we look at like what zip codes have at least 10% market share for a facility, and then it'll give you kind of an idea. But in this case, no, it's just showing where they're located and whether they're rural or not.
Okay. Another question about data: does it capture specific hospital services closed and or discontinued?
No, but other than the closed hospitals that we've added from the Shep Center, no, that is. But we are. We have been working on looking at closed services, because I think it's at a really important level to look at. For example, OB services, labor and delivery units that have closed. There are ways to use the cost report to determine whether a facility has stopped offering that as a service. Inpatient surgeries is another one. So that is a kind of something that we have been working on to show those in specific states, but also nationwide.
Wonderful, thank you. Another question: can states provide their own data to be added to the dashboard?
That is possible. In the case I mentioned, Delaware, it's the Delaware Health Force that has asked us, and we actually made a specific, not a specific version, but we just kind of made this dashboard, but it opens on Delaware, and then we send them an embedded link, and they were able to add that to their site there. But the people there said, some of the problems with some of the public data, the MPI file is not always the most accurate. It's the only thing but it's the best that's available there. So, but they have a state level of, what would you call it? Licensing data for physicians, which would be a lot more accurate because it's local. So, we said we'd be happy to add that to your specific dashboard if it would be better. So I think in that case, it probably wouldn't be available like like it is here as a universal resource, but we can always do something kind of custom if states wanted to do that and load their own data, because in that case they're going to have some more interesting data that we can get at a public level, and I think that would be very useful. We'd also, rather than looking at some of those measures from at a county level, like you can actually break it down to more, a zip code level, or like as somebody mentioned there with that question, a hospital catchment area, a service area level would be interesting. So.
Wonderful. I don't have any more questions at this time, but that doesn't mean we don't have more time. If you have things you want to ask Keith, go ahead and put those in that panel now. I'll be sure we address them. Or Keith, if you want to go back to the page with your contact information, I think that would be really helpful.
Sure.
Make sure you reach out with questions. You can email me, you can email Keith. That's completely fine. I'll make sure I put my email address in the chat for everybody. And then I did just have another question come in. Thank you. It says, can maternal mortality rate be added as well, including pregnancy-related mortality as a distinction between deaths earlier or later in the postpartum period?
Say that, maternal mortality,
yeah.
What was the qualifier?
So can maternal mortality rate be added as well, including pregnancy-related mortality as a distinction between deaths earlier or later in the postpartum period?
Oh, okay. Early first.
Yeah, versus earlier or even up to postpartum, I believe, or including postpartum.
I will look into that. I know that there is some data from what was the organization? I don't know if it's HHS had some county level maternal information. I will look into that. That's a good suggestion. Yeah, as long if if there's a data source that's available, that would be worth looking at as well. And I will check and see if County Health Rankings has that also. There's a lot of information. It's there's as you might imagine, there's tons of different measures that we can look at. So but again, trying to get it down, narrow it down to some things that are really relevant. But good. But I think that's a good. That certainly is relevant.
I did have a couple more comments come in with requests for slides. Don't worry, we can get those to you. You can reach out to Keith or myself, and I'll make sure you get them.
Yep.
And again, there will be a recording so you can share. Keith, if you want to, I'm going to turn it over to you for any closing remarks, unless a question comes in, and then I will close this out for the day.
Let me just ask you, Cody. Was everybody able to get the link from the chat? Did that go through?
I believe so. I put it in the chat again, so it's in there two or three times. You can reach it. I got a thumbs up, so it sounds like everybody did get it. And then I also put my email address in there and the orders. I'm going to put it right now. So.
Okay, great. Yeah. So as I said, feel free to reach out either using my email here or that the contact information on the contact form on the website, and let us know what you think. As I said, this was a collaborative effort with NRHA and Stroudwater and with NOSORH, and like I said, a lot of the stuff came from feedback from users, and we hope you find it useful. If you have any questions, just again, please reach out and let me know. And good luck with any applications or grant applications that you might be using it for. That'd be great. And again, thank you very much for your time, and thanks, Cody, for having me.
Yes, thank you so much, Keith, for joining us and for the information and sharing the dashboard. I know there's a lot of interest in it. There's some reactions going on right now, so I appreciate everyone's involvement today. I don't see any questions, so I will go ahead and close this out. We do hope you found this session provided you with some new insights and ideas to take back to your organization. As a reminder, again, it is being recorded, so don't worry, you will get the link to the recording later, and you are more than welcome to share that with anyone you think might find it helpful. That's what we're here for. We want you to share. There is a brief survey. I know we don't like filling those out, but I promise it's just a few questions, and I do review all those answers to make sure we're keeping these sessions relevant and impactful. And if you're looking for additional resources to use at your hospital or with your team, help with impact and finding solutions, please don't hesitate to visit nrhasc.com. It is a site built just for you, full of educational resources, a knowledge library, and of course links to all of our past sessions. And if there's something you're looking for and you can't find it, don't hesitate to reach out to me. That is my job, is to help you guys. That's what I'm here for. And finally, I'd like to extend a special thank you to Stroudwater and Keith for your ongoing support as a platinum partner with NRHA and a founding partner, not just platinum. Your commitment to improving rural health care is so important, and we couldn't do sessions like this in our conferences without you. All right, everyone, have a wonderful, I think it's Thursday. Yes, it's Thursday. Have a wonderful Thursday, and we'll see you next time. Bye, all.
Take care.